Thank you so much for joining. Welcome to Nursing Job Trends and Challenges webinar hosted by Healthy Careers. We have our panelist, Lanelle Weems, on. Unfortunately, Beverly Lane had ran into an emergency, so she will not actually be able to be on the panel, but Lanelle is a wealth of information, so you are in good hands. Over the next 45 minutes, we'll be talking about what you need to know to be successful in your job search, the challenges nursing job seekers will be facing, and most importantly, how to overcome them with our new panelist, Lanelle Weems, who I will introduce more in a minute. So just to introduce myself, my name is Sarah Bay, and I refer to myself as a nurse advocate, working in various roles in nursing over the last 9 years. I currently serve as a senior marketing manager for nursing at Healthy Careers after my time with ANA, the National ANA, and other nursing organizations. If you have any questions today, please put them in the chat, and we'll also address it during the Q&A. If you think of any questions after today, definitely please send us an email. You'll be receiving an email after this with the recording, so you can always respond to that. There'll be some information at the end about all other ways to contact us. For those of you who just joined again, welcome to the Nursing Job Trends and Challenges webinar hosted by Healthy Careers. In case you miss any of this webinar or have to leave early, we will again email everyone a link to rewatch it later. Healthy Careers is an industry-leading healthcare exclusive career resource and job board that has been helping healthcare professionals like yourself find a perfect job for over 30 years. In addition to thousands of nursing jobs from the top employers around the country, we offer career resources and services like free resume reviews, an AI cover letter generator, and the Salary Center. You can set up custom job alerts, search using our map location tool, and even try our new chatbot, which is actually pretty cool, on our website, which will help you with personalized job recommendations based on what matters the most to you in your career journey. Lastly, and I'm very excited about this one, we are excited to announce the launch of our brand new nursing career magazine called Vital Signs, which is launching in July. It will feature timely nursing news and job trends with exclusive articles written by other nurses like yourself, so by nurses for nurses, in a state-of-the-art digital format. The format is just really, was a very cool format, so you'll love it. Look for more information to come and register at Healthy Careers to make sure you don't miss the first issue. Again, that's coming in July. So I'm now pleased to introduce our speaker for today, Lanelle Weems. Lanelle Weems is the president of the National Forum of State Nursing Workforce Centers. She has over 40 years of experience in nursing with over 30 years in management and executive nursing administration. Mrs. Weems holds a BSN and MSN in executive nursing from the University of Mississippi School of Nursing. So just before we get into our conversation here, into the question, I'd like to get a quick idea of where you all are in terms of your new career opportunities. So are you currently looking for a new job? I'm sure some of you are actively looking while others may be more passive, where if a good opportunity comes up, you take it. Then some of you probably love your job and you're not looking to leave, but you're just seeking some information today on the profession from our expert speaker. So I'll give you a minute to answer. You can just type it in the chat. Are you looking for a new job? Are you passively looking? Where are you in your job search? You can just type that in the chat and then we'll get started. I see some hands raised. So. Oh, okay, answers. Currently actively looking for a new job, looking for any opportunity in teaching, but want the remote hybrid, so you want the flexibility. Makes a lot of sense. If we recruit from overseas, we do not currently really focus on overseas opportunities. Any other answers? All right, well, I know you're going to get a great amount of information today to assist you. I'll see more answers. Looking for a job, but you're a new grad and everyone wants 1 year of experience. So I'm sure it's something that Lanelle can address in terms of how to find a new job as a new grad. You love what you do now, but you're looking for the next opportunity that will spark your interests. open to learning the information, opportunities, and improvement. Awesome. Great answers. So Lanelle, we'll turn it over to you to ask you some questions. So first question actually is, what are some of the challenges that you're already seeing this year for people who are looking for a job in nursing?
Hey, everyone. I'm from Mississippi, so if you hear that Southern drawl accent, you'll know exactly where I'm from. I just want to add too, I'm currently the executive director for the Mississippi Center for Quality and Workforce as my real day job. And then I currently serve as the president of the National Forum of Nursing Workforce. Just to give you a little background about the National Forum before I get started with this question. The National Forum is a collective of, we have 43 states right now with nursing workforce. We call them centers, but they're all different kind of organizations, if you will, that that come together, and we look at workforce data. We look at supply, demand, and preparation. So we're hoping to have our finger on the pulse of what's going on currently in our states at the local level, at the closest level in our state versus national trends. So there are all different kinds of nursing centers. Some live in the boards of nursing, some live in universities. My office lives in the Mississippi Hospital Association, so there's associations. There are virtual. There are health workforce data centers. So some of them do data collection and analysis. Some of them do programmatic things. And so we're all working to have an adequate workforce for our states and collectively across the United States. So challenges that you're seeing are anticipating in job seekers this year are really kind of hard, I guess you could say, to say what you're seeking. Just like someone asking the question, everyone's wanting 1 year of experience. To answer that question as a challenge, did you have an externship? Did you have an internship? Where did you do clinical? Would these be optional places that would hire a new graduate? Most of our hospitals do hire new graduates, but they want to balance out those in need that have some experience. As you all know, COVID really wiped us out, so there should be opportunities throughout the United States, especially in rural areas. Those are where we need jobs, need staff really a lot. I want to encourage you as a job seeker to consider a rural hospital. It's not the glamour and lights of the big facilities, and everybody wants ER, L&D, and ICU. Well, everybody can't work in those. We call them glamour units. So consider a rural hospital, because there you are going to see everything from infant, childbirth, all the way through the life cycle to the end of life. So I would just want to encourage you to consider rural hospitals and ambulatory surgery centers and clinics. And mind you, you're going to have to get in and learn and be willing to set your foundation, if you will, for nursing practice, especially if you're a new graduate. In Mississippi, we have what we call externships, and those are a one-on-one preceptor relationship with an experienced nurse. And so those are things. There are apprenticeships out there for various nurse residencies. So you might want to look at a facility that might have a nurse residency program. So one of the challenges you're going to see is not everybody can work 7 to 3 Monday through Friday. And I know work-life balance is important to everyone. So there are some things that are going to be hard to find if you limit yourself into certain days and certain hours. In a cycle of life, there are times in our lives that we can work different shifts. That we need to work day shifts. I experienced that myself. Whether you have children or your caregivers or partners or whoever that needs you at a certain angle. Those are some of the things that you have to consider that may be harder for you to find a job that matches that in hospitals. Now, there are more than hospitals to have a job. And those, like I said, are clinics, ambulatory service centers, home health, um, industry. There are huge corporations that hire nurses, huge factories that hire nurses within their facilities to have clinics in their factories and huge facilities. There are teaching. We need nurse faculty really, really, really bad across the nation. Whether that's virtual nurse faculty or hands-on, where you do hands-on clinical with the students. So there are opportunities for education, but again, those require advanced degrees. So looking for jobs, looking for work, there are going to be challenges filling out. A lot of people want online applications. Make sure you complete your application. Fill in all of the blanks of the necessary information, because they're not going to reach back to you if that application is not complete. So those are some of the challenges that job seekers in nursing are finding. Unfortunately, a lot of folks after COVID didn't want to come back to the bedside. We're beginning to see folks come back, but we're also losing our experienced, knowledgeable nurses either to retirement, getting completely out of nursing, or moving to a different type of facility other than a hospital. So I hope I've touched base on some of the questions that you may have. Anyway, Sarah, if you can kind of keep me up with any questions that come through in the chat, let me know, because it's hard for me.
Oh, of course. And yes, please, everyone, put your questions in the chat. We'll definitely address them at the end during the Q&A. Thank you for the answer, Ms. Lanelle. So I'm hearing, being flexible in your shift options, the practice setting, and also just, using all those opportunities for kind of learning on the way. So there was a question about being a new grad. So you mentioned externships and, nurse residencies, which could probably assist them, even with just not having as much experience, probably having something to present to those kind of recruiters who are looking for at least 1 year experience. So hopefully that answers some of the questions, but if you have more, please write them in the chat.
I see
Sorry.
one in the chat from Susie Kepper. I hope I didn't butcher your name there, but she says, I'm 62 years old. I think I'm facing ageism. I graduated with my DNP yesterday with little nursing experience. I'm a clinical nurse specialist, advanced practice nurse with experience as a mental health nurse and long-term care. I'm looking for a job in hospital education or quality improvement. I can't tell you how many rejections I have received. I am beyond myself. Yes, having an advanced practice degree, especially you worked hard for that DNP. Congratulations on attaining that level of education, if you will. As you know, as an educator, um, you know, we're all faced with getting in the credential and then getting a job to match that credential. We have in our state, we have a lot of people obtaining nurse practitioner level, and they are working in RN jobs. They are not, being utilized, but then that's in the metropolitan area. Out in the rural areas, we could use them more. So sometimes it's, as people refer to it, as maldistribution of nurses. So we have enough nurses. Your board of nursing may say we have enough nurses in our state, but they're not working in the areas where there is need. With it, advanced nurse practice, DNP, and you wrote on there with little nursing experience. So, that's, I don't know if that's what they're looking for, but I'm telling you, there are quality jobs out there. I'm not sure what state or area you're from, but there is quality positions desperately in need, infection prevention, quality, which quality is a huge umbrella of different things that fall into quality now. There are jobs at regulatory agencies such as Joint Commission, DNV, outside of a hospital setting. A lot of hospitals may move to the model more of education on that unit versus a centralized education department. That presents challenges. Again, hospitals are faced with financial challenges every day, which they have to find that balance for workforce and then, their patient population that they have. You live in Oklahoma City, so that's a rather large city. I would think, have you checked with all the hospitals in the area, not just the large hospitals? I would encourage you to do that. And then check back with your education providers. There is a DNP, I'm not sure what's required in your state. Check into those requirements for education, but you have to have a master's level or higher in education to teach. And so I would definitely encourage you to look at that as well. So it's okay, Veterans Administration, but they're on a hiring freeze. Yeah. Someone posts the NAHQ has National Association has job postings. So your colleagues online are giving some suggestions as well as to what might be available.
So I'm hearing a lot about flexibility, right? So if you're not finding it in the perfect situation, being a little flexible and then trying to move on from there seems to be kind of a key theme I'm hearing as well. Innocent, I saw your question. We're gonna address it during the Q&A, but I saw your question, Innocent. Thank you. So just another question, another kind of little summary question. You guys can chat in the chat about where you're looking for nursing jobs. Are you using a job board like LinkedIn or a healthcare specific job board like Health Careers like ours? Are you going to the site of your specific employer that you want to work for? Are you using your state nursing association that you might be associated or another nursing association? So how are you looking for your job, a new job opportunity right now, or how have you looked for a new job opportunity in the past? And you can just type that in the chat. I'll give it a couple of seconds, and then we'll move on to the next set of questions. So how are you looking for your next job opportunity? LinkedIn, okay. but also a traveling agency. Yeah, travel nursing is definitely very popular right now.
Check with your state hospital associations because many of them have workforce directors that know the needs in the areas that might can direct you for somebody, a hospital that's looking for certain folks with certain credentials. Check those as well. Check your local Department of Labor. Um, we call them WIN job centers here in Mississippi. Workforce, they have jobs that are listed. Your state agencies, in Mississippi, we have state agencies post their jobs on a particular website through the state agencies. Your boards of nursing may need some help. They have jobs available as well. So there are lots of different places that you might not think about that I can look for a job, because anybody that's a state agency, and there are hospitals that are state agencies, post jobs there as well. Especially the schools and in the education division are going to post jobs there. So there are also training jobs for CNAs and LPNs in schools that need nurses to help teach our pipeline through. In Mississippi, we have not nurse navigators. Oh gosh, what are they called? They have just put them in all the high schools to help students select job or career opportunities, and helping students. And healthcare is a huge one of those. So you might want to check your local Department of Education and see if they're hiring nurses. We have clinical science academies in all of our public schools in Mississippi, and those teachers are RNs in that class. So there's a broad opportunity. That's the beauty of nursing. You can look in all kind of different areas. Now, I don't have a pay scale for all of these kind of jobs, but that would be on your research of what you needed to look for, of what your expectation and what you want to acquire for pay scales and benefits. I will tell you that the dollar is not the only thing when you're looking at a package or looking at for a job. The benefit package that goes along with it can have a lot of value in it versus that take-home dollar. And then you're going to have taxes taken out. If they offer a 401k or retirement plan, you're going to have that taken out. So there is a lot to consider in a benefit package. It can be up to 33% of what you take home pay, for what comes in your checking account at home. So be sure and look at the benefit packages too. You can find a lot of value there.
Thank you, Lanelle. And Dawn, I saw your question as well, and I see Toby have a question. We'll address that shortly in the Q&A. And Lanelle, you just mentioned two things, so salary, and we have a salary center that you can always use to make sure that you're competitive with the market and look at what your pay scale is compared to other candidates. And also on our website, you can also filter by benefits, which I think is a huge deal, a shift, laying things along those lines. So just a reminder. I know you and I talked about this for a little while last week, is how AI is going to impact how recruiters look for candidates. So, and just the job market in general, and what I'm sure there's a few nurses who mentioned they've been in nursing for a little while. So just kind of the role of technology and the advancements in technology and how that's impacting job searching.
I will tell you, I'm not experienced in AI. And I am just beginning to learn. And then AI is moving its way into healthcare, but you have to be very careful with. But as for a job seeker, I'm afraid I can't answer. I can't answer that, but AI is entering our lifestyles in all kind of ways. So I'm sorry, I don't have the experience or the knowledge with AI to help let you know where it is, but we're in very beginning stages of AI, and you're going to see that out there. Um, and everybody is is going to be impacted by it.
So how will workforce issues such as like nursing shortage and burnout impact job seekers and job recruitment?
Well, it's nursing shortage and nursing burnout. Nursing shortage, and I see a couple things that since COVID in the questions in the chat, it's harder to find nursing jobs, especially without experience. And that's because the knowledge has walked out the door. That's why they're wanting experienced nurses to, you will see a demand probably more for that. Again, be willing to work, you know, and learn. Do they have a nurse residency program? Is there an internship where you can get a job that an internship is offered to maybe you can have some training with it? Harder to find nursing jobs, especially without experience, and that's hard. We all started with no experience. And that's why I refer you back to maybe hospitals that you did your clinical in, especially if you're a new grad. And then for the advanced degrees, that's going to be, I'm going to quote my nephew who making profound statements when he was in college trying to look for jobs too. And he said, it's not the grades you make, it's the hands you shake. And so it's building relationships with people. And I know you say, well, how do I get to know people? Be involved in your nursing associations, your advanced practice nursing associations. They're going to have people there that can help guide you, or people to contact or mingle with or network with, where you might can find a job of what you're looking for. Harder, especially when you ask about disparities in jobs. There are on that disparity about COVID related, we have hospitals that still have beds closed because we don't have enough staff. And it's regionalized, I guess you could say. I'm in the South. Other states have bounced back, and they have a pipeline that they feed in those areas. It's going to be hard to find a job, but you may have to be willing to relocate and expand your boundaries there. If you're in a state or a city or that seems to be maxed out with no jobs, I can't imagine that being the issue, because there are plenty of jobs out there. But I know a location has a lot to do with it, whether you're urban or rural or micro or metropolitan. Those jobs can be harder to get, but you're going to have to compromise sometimes in jobs in order to get a job. Come to Mississippi. Can I be my own promoter here? There are jobs in Mississippi to be had. So another place, let me tell you, where jobs are for nurses are insurance companies, MCOs, especially for Medicaid. There are, lots of jobs in those type of companies. I forgot about them. Where insurance companies, public, private, commercial, it doesn't matter. There are jobs for nurses in those areas as well. So the work is hard. Everybody expects you to do more with less. That is a real thing, and that is hard work. Um, it's hard work as what what we're facing today. Um, CMS just came out with nursing staff standards for long-term care. They've got to have RNs around the clock. So if you have not worked in long-term care, you might want to be interested in looking at long-term care and having them. They have now required hours for nurses, CNAs. So there's an increased need in long-term care for RNs, especially with this new rule that's come down. Some states have staffing standards that they have to meet, and that is driven by legislative policy a lot of times, and most times for staffing standards. Some states have them, some states do not. So I would encourage you to look at states with staffing requirements, and they might have more jobs there to fulfill those requirements than states that do not have that right now. I will tell you, hospitals and places don't like to pay overtime, and they don't like to pay travel nursing. That's very expensive. There was a question about travel nursing. Do you see options? And travel agency is really for demand. There's a supply and demand issue, and that's where, in my golden days as a CNO, when somebody went on maternity leave or you had somebody out, you went to an agency and said, "Hey, I need a nurse for 6 weeks." But COVID changed all of that. COVID changed it, and you could get paid a higher wage by on travel nursing jobs. And again, that falls in the supply and the demand issue, what's going on in those facilities as well. I personally couldn't be a traveler. I like to have consistency in my job, knowing who I work with, and the policies and procedures and the structure of the organization. So it's not for me, but it is for some people that have that ability to move around. I will tell you there is a decline on demand for travel agencies versus what it was at COVID. And hospitals are trying to have their own. So, but there are, I still know people that work travel. That's all they work is travel. And so they're willing to take on these assignments, and sometimes they're limited time and sometimes they're longer stints that you have. But you can invest and look into that and research that to see if it's the right thing for you. Nurse burnout. I will
Go ahead,
tell.
go ahead. No,
I don't
everybody's
want to
loving the
get in on our
information. I'm getting
time.
a lot of comments, so go ahead.
Nurse burnout is real, and you have to take care of yourself. And it starts with yourself, that you have to take care of. And you can say no. And I have trouble saying no myself to what you are working. We have those that want to go all the time, and that's perfectly fine that you are motivated to do that, but you have to be careful and do a self-assessment and do self-care. I will tell you, it's all about job satisfaction, whether you're going to stay in a job or not. And you have to find the job or find where you work that you're going to be satisfied. And I tell my hospitals and my employers, that's what you have to look at, is satisfaction of what the new employee wants, the new job seeker wants in their job. And it is a balance. It's not like when I started work, you were kind of, when the hospital called and they needed help, you dropped everything and went in, and it's no longer that anymore. Like especially for work-life balance. But I must encourage you to take care of yourself first, and then your job.
Thank you for that, Lanelle. We have a few questions. So before we get into the few last questions we have in the last 10, 15 minutes that we have left, I just wanted to also mention we do have a wellness coach who's an RN. So she focuses squarely on that. How do you still, thrive in your career, but make sure that you're taking care of yourself, as Lanelle just mentioned. So that's another resource that we do have. So as a last question, what other career-oriented topics do you feel like you would want to hear more about? If you want to type that in the chat or in the Q&A, and then we'll get into the few questions that I saw come through. So any other career-oriented topics that you all are interested in? Type it in the chat. Let's see what I missed here.
I will tell you there is a new model of healthcare with virtual nursing, but most of them are required for experienced nurses. But if you have experience, some hospitals are doing that, especially for admissions and discharge planning and teaching on a unit. We have hospitals that I personally know of that have trialed that, and the staff nurses love it because they get to spend more time with the patient or the needs of the patient than in the teaching mode. And sometimes that's from home, sometimes it's from a hospital setting. You may go into a virtual space, I guess you could say, and help with the movement and the preparation for patients for discharge. So that is another new model that has come up on the horizon, if you will, so that you can search virtual nursing jobs as well.
So a couple comments that we did get, people wanting to learn more about new fields of nursing and other areas to get into as a nurse. So Lanelle did mention industry earlier. I saw someone talk about legal. Continue to let us know other topics that you would like to hear more about. But I saw 2 questions about remote work. So Lanelle, you kind of just touched on it. We're talking about the virtual model, but you want to elaborate a little bit more about what's out there for remote work? How do people get into like the remote working space as a nurse?
Yes, virtually, like I said, the virtual nurse at the bedside is coming up. There are virtual jobs for nurses, especially I have seen some of the quality people work from home. Informatics is another huge area for nursing. Data is so important right now. Decisions made with the data that is there is so important. So informatics nursing is huge going forward. And data analytics, I guess you could say, if you have a knowledge base for that, that is going to be tremendous. Some people want to work from home. Case management is another one of those jobs that you can work from home with different case management, whether those are services within a hospital or whether they're contracted through a company that does case management for hospitals or nursing homes or those types of jobs as well. There is, let me just say, psych mental health. We need help nationwide with our psych mental health, substance use disorders, tremendous amount of work needed for psych mental health practitioners, whether you're at the RN level, the advanced practice level, you know, psych mental health aides to help teach these folks about psych mental health nursing. There is a tremendous need. You can look at your state psychological hospitals. We have state hospitals in Mississippi for mental health, behavioral health. Well, while a lot is moving out to the community level, there is still inpatient level. I see a comment about mental health is dangerous. That I won't deny you that comment. There is a lot of workplace violence that's going on, and that is on one of the top lists, and I'm gonna say more than top 10, top 5 areas that hospitals are working on is workplace violence. So that, that is a concern. Some people love psych mental health nursing. So it is not in my lane. I will tell you that, you know what type of nursing that you chose and that you're good in. And so those are other opportunities out there in psych mental health nursing as well. And especially in advanced practice, we are seeing some models of clinics that include family practice for nurse practitioners, but also the psych mental health, so they can get those types of needs taken care of in one place. So I will let you know that is true. That is a real thing as well. So
I saw a few mentions about salary here as well. So we have 2 questions left before we wrap up here. But I've seen a few people kind of mention how do they get the salary they deserve? They're being offered more on the lower end, or if they're experienced nurse, they're still being offered less. So how do you get the salary that you deserve to be paid?
well, companies set their salary ranges, okay? So, especially after COVID, I will say, in travel nursing did impact salary demands, and hospitals are struggling financially. I will say everything's gone up. You all know that. I don't know if you saw Mississippi has the highest grocery grocery tax in the United States, in Mississippi. So everything's gone up, but guess what has not gone up? Reimbursement. Reimbursement from Medicare, Medicaid, commercial insurances, self-pay. People are struggling to even do that, but reimbursement has not gone up along with the trend of everything else. And so hospitals are having to pay higher prices for supplies, for infrastructure, for utilities, all those kind of things. And unfortunately, our salaries don't get to go up as high as what we think we deserve, because nursing is hard. It's not an easy job. It's not at all. So that may be a reason why hospital salaries are not as high as you might expect, or wherever you go work. We struggle with nursing faculty salaries all the time. They are not equal to nursing out in the service area, or at the bedside or practice side, or whatever you want to call it. Education, nursing educators, there is an inequity in salaries there. And so we struggle, and we advocate through your nursing associations, and we don't have labor in nursing here, but there are other states that have unions, and those are negotiated, I know, through that aspect. But those are some of the reasons why salaries are not higher than they are or could be, is reimbursement. And nursing is, as you know, is in the room and board label on reimbursement. Nursing is not costed out. So that's, those are issues that hospitals struggle with every day. I must tell you, HR struggles with setting salaries, but they have to balance that out with what comes in for reimbursement and the demand that's out there. So I hope you find a job that you feel worthy in your salary versus you know, what's out there. But I would ask for ranges of what is the range, minimum, and max, minimal, mid, and max level salaries, and what requirements are required in those areas. So it has to do with cost of living. I can tell you cost of living in Mississippi is completely different from cost of living in California, New York, Nashville, Tennessee, um, in living here. So it has to do with cost of living too, as well. And you all know those have increased tremendously. So those are some things to consider on that, what you think you deserve, which I highly I think there are a lot of different jobs in healthcare that deserve higher wages because it's hard. Their jobs are hard and demanding, labor-wise, physical demanding. So just want you to keep those thoughts in mind. So you know, I don't know. I'm trying to look at the chat too to see
No, they said preach
what
it,
else is
sister. So
out there
you're
for
giving them
remote
the great
jobs.
information.
Somebody's got a good point. You can be tied to a desk for 40 hours a week. And, I've worked at home in my job before too. And it's hard, especially if you're a people person and like to be around people. During COVID, they sent us home from our office and I worked at home, and sitting at that dining room table in that hard chair was painful at times. It was lonely at times. There are things that you can get for around work, the people that you work with. It you know, there's support there in there too. So you have to, there's all different types of jobs and things. So preach it, sister.
So on that
Gosh.
note, Lanelle, since we have just a couple minutes left here, if anybody has any more other questions, please feel free to reach out to us. We're going to wrap up here. Thank you so much, Lanelle. This was some amazing information. I've got a lot of comments in the chat and in the Q&A, just asking, not only asking questions and being engaged, but also saying that they got a lot of great information. Of course, I knew you were going to do that, but thank you so much for your time today.
Well, thank
You
you
can
for
always
letting
follow.
me have an opportunity to have a conversation, because I didn't prepare slides or anything like that. This is real conversation, and sometimes you can really gain a lot of knowledge. I learned from you, you learned from me. So
Absolutely. You can always follow up with us at healthycareers.com, follow us at IG, Facebook, LinkedIn, shoot us an email. We have plenty of planned activity coming up for National Nurses Week because we celebrate you as nurses, which includes a chance to win a free wellness coaching session. So look out for that. And we'll email everyone a link to this recording later, so feel free to share with anybody else if you think will benefit from this discussion. Again, thank you so much, Lanelle. Thank you all for attending. I hope you received some valuable information. You guys have confirmed that. So thank you so much, and everyone enjoy their day.
okay.
Thank you
Have a
all.
great day, everyone. Bye-bye.